Hey, everyone. It's Dr. Tamar Beckford with Your Caring Dogs, where we're going to highlight some great doctors. But first, we are going to let you know what's going on in your body. We're going to break down some of the seemingly complex medical info, break it down so you completely understand. But we also have special segments, which I am so excited to do, where we have Your Caring Docs, Docs Who Care, where we have docs from all over the world coming in, enlighten you on health and wellness info. Today, we have a special doc here today. Her name is Dr. Andrea Staneata, and she is a PM&R specialist. You're like, PM&R what? What are these letters of the alphabet? It doesn't matter because she's going to break it down for you, right? Let me give you a little bit of background about Dr. Andrea Staneata, and then she's going to give you some more. So Dr. Staneata, she graduated from the University of Medicine, Pharmacy, Science, and Technology in Romania. That's right. Then she did 2 years of residency in ortho and trauma in Romania. After that, she came to the US and she did residency and fellowship here. She did residency in PM&R. Like I said, we're going to tell you what that is, at East Carolina University in Brody School of Medicine. And she did a fellowship, and she was a chief, because she doesn't stop there. She's a top dog, like we said here in the US, top dog. So she was a chief resident. And then she did fellowship in spine and pain management at Winston-Salem in North Carolina. Because we know we have a top dog here, we are gonna give a round of applause for Dr. Andrea Staneata. Yes, Dr. Staneata. Welcome to Your Caring Docs, Docs Who Cares. How are you today?
Hi, Dr. Beckford. It's a pleasure to be here and an honor. You are amazing. Love your energy and all your posts. You are spreading science and knowledge to the World Wide Web and everywhere else. So I'm just so happy to be here. I'm doing great.
I'm happy to have you because you're going to break down some info, because people are like, who is Dr. Staneata? If you haven't looked her up, you need to look her up. We're going to talk about all the stuff that she does, and we have a very special thing because we have an author in the house. So not only is she a great physician, but she's also an author. Alrighty, before I gave a little bit of background about you, but you tell us all about yourself. So give us a little more background about yourself, Dr. Staneata.
Thank you. I think this is the hardest question because I don't like to talk about myself. But as you mentioned, I was born and grew up in Romania. I did my medical school training in Romania and some residency training upon coming to the United States 15 years ago. I can't believe time flies by. I wanted to continue in the musculoskeletal specialties, of course, and I found physical medicine and rehabilitation. I gave it away. That stands for PM&R. And it was a very rewarding and awarding residency training for me. And from there on, I specialize in interventional spinal procedures. However, I like to stay close to my core training and do different things and not just practice one slice of the pie, so to say. I have been in North Carolina ever since residency training, fellowship training, just different cities, and I'm established in Fayetteville. That's where I work and treat my patients.
Wonderful. So like we said, we gave a little sneak, PM&R, Physical Medicine and Rehabilitation. So tell us, what is PM&R? We hear Physical Medicine and Rehabilitation, and I'm pretty sure that in other countries it has different names. So explain to our audience, what is PM&R and what does someone who specializes in PM&R, what do they do?
Absolutely. So physical medicine and rehabilitation, or physiatry, that was the order nomenclature, is a branch of medicine where we aim to enhance and restore functional capacity and quality of life for our patients with physical impairments and disabilities. We also treat a very wide variety of conditions which are affecting the brain, the spinal cord, nerves, bones, joints, ligaments, muscles, and tendons. Many times I get this question from my patients: what do? You are not a psychiatrist, are you? And I always say, no, far from that. However, our specialty is a combination between neurology, orthopedics. We treat everything which is not non-surgical, so to say. And part of it, a huge part of our specialty is really the rehabilitation part, which is very, very important. We rehabilitate in the inpatient setting, everything where everybody who had any kind of major interventions. It can be cardiac rehab, pulmonary rehab. Since COVID is very popular,
Yeah.
patients after joint replacement surgeries, major neurosurgical interventions, not to mention the spine surgeries, anything and everything which interferes with a person's capacity to function. We also have the acute traumas where, many times after the fracture are healed, these patients unfortunately can end up with serious or life-changing events such as traumatic brain injury, spinal cord injury, and they need treatment long-term. We also treat children. We have Peds Rehab, which is very, very rewarding and awarding in its sense. I think that was the rotation I loved the most, and I always said I could not do it just because I'm a mother as well. But my heart was going out for the children and their parents, but it was just wonderful. So yes, that's in a nutshell, I guess. I hope I broke it down a little bit more. We treat lots of musculoskeletal conditions and then the post-acute conditions and the rehabilitation of them.
Oh, wonderful. So we're basically we're getting patients who have had any type of life-changing event that's altered their ability to do what they were able to do prior to said event. You're trying to get them as close back to what they were functionally. And that's your specialty. So physical medicine and rehabilitation, a lot of rehabilitative portion, a lot of physical medicine portion, right? Or physiatrist, not to be confused with psychiatrist, physiatrist, physical, right? So that's what it is. All righty. So now let's go ahead. Now with that, we said that there are a lot of patients who've had neck pain, back pain. I mean, that is so common. Look at us. We're all sitting all day long. And then we've had patients who've had like any particular traumatic accident, whether it be sports or in the car. So when that happens, we are here suffering with neck and back pain. And I know that that's something that you see very often. So enlighten us in how your thought process is and how you help these patients.
Absolutely, I would love to. So definitely, Dr. Beckford, your specialty is emergency medicine, and I know that in your field, the second most common diagnostic you see is low back pain.
Absolutely.
So I'm here to help take over
That's
some
at
of
4 a.m.
Yes, yes, exactly. So definitely, so the bread and butter specialty, especially because I work outpatient mostly at this time, is musculoskeletal conditions, low back pain, and then neck pain. So the most common things are really either an acute or chronic flare-up. So let's say the patient's had an episode back in the 5 years ago, 2 years ago, 10 years ago, and they have another flare-up. They said, yeah, I feel the same. I just woke up with this pain shooting down my leg. I can't go to work. Help me, fix me. So many times when the patient is just a new flare-up, we break it down. Medical management would be a very good anti-inflammatories. Many times we recommend physical therapy and then some type of injection infiltrations to calm the inflammation on the nerve roots themselves. But sometimes it happens that the patients, by the time they make it to me, to see me, they already had an imaging study, an MRI or something, some sort of imaging done, which is very, very helpful because then I sit down with my patients and their first visit, I always explain and break it down. This is what's going on because, patients are, they are worried. What am I going to do? I want to get back to my work, my family life. I want to get back. Lots of them are very active. Absolutely. I want to get back to my running. This is what I enjoy. And I haven't been able to do so in the past 3, 4, 5, weeks because this is not going to go away. So I always educate my patients. I break it down to them. I put out my spine model and explain, okay, this is and with the MRI, this is what's going on. This is what we can do. And I think it's very, very important for our patients to understand what's the cause, what can be done, and what to expect. And then we have a plan. And they are so thankful and feel so much better about everything, and they are more open to try different things. As I mentioned earlier, our population, of course, is mixed. If we have more like a chronic patient, then we have other things to offer, but it's just very, very rewarding. And just having that report with my patients from the start. and explaining them, okay, this is what we're going to do, and we can just help you. And even if it doesn't go away, because many times, can you fix it? Is the degenerative disc go back normal? And I'm like,
doc.
exactly. And I say, unfortunately, once we have a disc bulge, it's not going to, recover. It's not going to come back. We cannot reverse time and get younger. However, it can be managed. And if it happens again in the near future, I'm here, I can help you. So it's very rewarding every day. Honestly, I love everything, what I do and what can I offer to my patients. So.
Oh, that is so nice. I love it. We're saying like, hey, we're not going to be able to reverse. No, you're not going to be able to do that triple jump that you did 25 years ago. However, we can help you manage so that you can live a fulfilling life and be able to still be active. But let's work with you with this plan, right? And we're working on this plan together so that we're both having you, and we work together so that you feel comfortable by the time you leave that office. Love, love, love. So now we know that like with a lot of rehabilitation, we think about a lot of times with rehab, we're thinking about like, okay, accidents, like, oh, someone got shot. Like I remember a couple of years ago here in Texas, we have a rehabilitation center here. There was I think she might have been a senator in Arizona, right?
Yes.
She got shot and she got sent here to the rehabilitation. So we're thinking of the traumatic. However, we also have people who have rehabilitation based on things that are non-trauma in the medical sense, but it happens, right? It's traumatic emotionally, but it's non-trauma in the medical sense, such as you have someone who might have had a stroke, or someone who's had, recently diagnosed with multiple sclerosis, or they're having, or even we said that we have some people with spinal cord injury that might be traumatic. And then you have people who were born like kids with spina bifida. These things cause this thing that we call spasticity, which means that they're just really having these laxity or just spasms of these limbs, and that impedes their quality of life. I know that you help and you're able to really bring your magic to these patients. So tell us how are some of the ways that you help these patients with spasticities?
Absolutely. So there are different types of spasticity, as you mentioned. When it's like stroke patients, usually it's one or two limbs affected, either one side of the body or just an upper extremity or lower extremity. Patients, let's say, who have brain tumors, even after the tumor has been removed, unfortunately, they can end up with weakness, and then that becomes a spastic limb, which means they cannot move the limb on their own. The more advanced spasticity management with a multiple sclerosis, because that is progressive, unfortunately, so we're always kind of chasing it. It's a different kind. And then we have our pediatric population, the children, spinal bifida, cerebral palsy, where let's say both lower limbs are affected, and these children have a hard time walking, or if they are walking, as they grow and they reach an teen life and a young adult life, they are doing fine. However, they are become very, very stiff. That's the layman's term. They cannot really function or walk, or they can't use their walker anymore. They have to go in a wheelchair. Many of these patients, we just really help them to be comfortable, not to have, because of the tightness of those limbs, caretakers have a hard time transferring them from the chair to the bed, or caring for them for their cleanliness, or the spinal cord injury patients where they cannot stay still or lay still because the muscles are spasming. So treatment for these, depending on the severity and the extensiveness or extension of the muscles and limbs involved, we can do toxin injections, which is botulinum toxin. I know everybody, when they hear Botox, oh, it's cosmetic. It's not cosmetic.
You mean I'm trying to get this beauty? No.
No.
Botox was not originally used for that.
Correct. But it's very, very rewarding, because we can, as I said, we can help these patients not be in pain, not have these spasms, caretakers to even prevent skin breakdown, because once they are stiffened up, you can't really open up the limb to keep the moisture away. Their skin breaks down, and then brings skin infections, and from there is just more downhill. It is very, very rewarding. Another option what we can do for these patients is to do a baclofen pump trial, which means because these patients are all taking muscle relaxers, and baclofen is one of the muscle relaxers which taken orally helps. However, it has the side effects of sleepiness. So patients, yes, their spasms may be controlled while they are sitting in their wheelchair, and they are not, have these jerky movements, or they don't have as much pain, but they can't enjoy their family time, they can't enjoy other activities. So the trial itself, what my part is, what I do a spinal tap. I inject a small amount of baclofen, the medication, into a take hole, and I monitor the patients, and it's just so amazing and rewarding to see these patients who have been like this, to be able to, we can range the limbs, we can move, and their family members usually are with them, one or two, and we even take videos and pictures, just to make sure that they understand. And I always encourage them, please see, this is what would happen if the patient gets so it's a trial, which is good. And if the patient is responding, then we can go ahead and refer them to the surgeon, so the pump itself can be implanted. Now, the pump is implanted under the skin. I do the refills, we program it, we get the right dose for the patient. I mean, it's just like I always tell my patients, well, first of all, this is a long-term relationship with me.
Exactly.
Because you will have to come every so often. We have to refill your pump, and it's just so amazing. And they are so thankful and grateful. And it's just one of those things where it's the rewarding aspects of our profession. I have a patient, wonderful family, a very rare genetic disorder. So this is another one. We see so many things outside of the box, which is a muscular dystrophy. So what happens is, as he ages, becomes, and it's transmitted by the females in the family, but only males get it. So it's one of those X-linked recessive conditions.
Right.
The patient himself, he has, as he ages, he has harder and harder time walking because of the stiffness, spasticity he develops. He's very determined. He works full time. He's like, no, I'm not giving up. However, he can, let's say if he goes up a few steps, he cannot carry anything because he has to hold on. He used to do that a couple of years ago. It was better. But as time progresses, his stiffness and spasticity is pretty okay controlled with the botulinum toxin injections. We do them every 3 months. However, we have been having more and more the conversation about, let's just see how it goes, because it's affecting mostly the lower extremities, and he would be a great candidate for baclofen pump trial and then the implant. But he's young, and he's like, well, I'm going to wait a little longer. And I'm like, okay, well, you let me know whenever you're ready. I always kind of bring it up. And yeah, it's just very, very rewarding to see these patients, despite of their impairments or disabilities, whatever they have to deal with on a daily basis, to see them to be able to be fully employed and still do what they need to do for our society and for themselves is just amazing.
Oh, wonderful. So at this point, I really think that, like, your patient population, you have the added reward of seeing patients who are not just physically strong, but they have a lot of mental strength. Absolutely. The determination, the drive that's there, that goes along with the physical impairment that is affecting them, that you are able to help them to overcome some of these challenges, but their strength and drive brings them to overcome even the second half of that, right? So absolutely. They are basically warriors. And that kind of leads us to the second half of our interaction with you, is you letting us know. So you are helping warriors who are overcoming challenges within their physical embodiment, right? But you yourself is a part of a project called the Warrior Woman Project. And you are an author. Show us that book, doctor. Show us the book.
Yes, my book.
Warrior Woman Project.
Yes.
Yes.
It's a sisterhood of immigrant women. So it's a coffee table book, an anthology, so to say. And how I came about this project, it's amazing. Like, it started in January and it's published in May. So it's just amazing. Like, it's something great came out of this pandemic, for the 22 of us who contributed to this. So it's an anthology. We speak about our immigration stories. 22 amazing ladies from all over the world. We are all over, literally. And we talk about immigration and how it impacted us from 14 different countries. Our leader, Dr. Lulu, he's a great advocate. She's a pediatrician. She's a great advocate for children, and definitely, she's on our side, and she kind of pulled all of us together We
Nice.
haven't met in person. However, we know each other now online and all that. In this book, I become a little bit more personal, so to say, and I talk about my personal life and my immigration story. And the reason my why behind it, it was because I had my own struggles and tribulations, and I see myself on the other end. I'm in a way better place now, and I would like to encourage other women going through similar situations. And that's why when the opportunity came, I did not hesitate. I remember Dr. Lulu texting me and she's like, would you be interested? And I immediately, it was middle of the clinic, and I said yes. And then I said, okay, God, I give this to you and the universe, and it
That's
will
so
work
sad.
out. Yes, and it worked out. It was just amazing how everything came together. So yes, thank you for for mentioning it.
Well,
That's
give
it.
us a little bit of a highlight of your portion of the book. So, like we did mention, you were born in Romania and you did come here to the United States. So, give us, like this, we'll say just two challenges that you were able to overcome and how you see your part in this book helping those who are probably experiencing or will experience the same thing that you have.
Absolutely. So coming to a brand new culture, brand new country, you know, and then facing the fact that, you know, I had to redo my training, the board exams and all that stuff, and getting into residency training, it takes lots of grit and determination, and, you know, of course, and it's doable. So I would encourage everybody not to give up on themselves and keep moving forward, keep working towards your goals. My other biggest big hurdle was, this is very personal, but it's up in the worldwide
It's in the
web.
book.
And yes, it's in the book. I was married, and I came with my ex-husband from Romania, and unfortunately it was an abusive relationship. And being in the middle, you know, you went through our medical training here in the United States, and it's great and everything, but you need lots of help and lots of support, which I did not have. I had two small children, and it was very, very trying many times. And by the end of my training, I felt like, oh my goodness, I felt empty. I felt I can't deal with this anymore. I can't take everything as one person. And then things, you know, things worked out. Thank God. I mentioned it in the book. And I had to technically pack up my children and leave, because it was detrimental towards them mentally and physically, and towards myself as well. And I'm just very thankful to the fact that I am on the other end. However, going through that process, it was not easy, because I don't have anybody here. So what I would encourage other women, you know, who struggle with any kind of issues like that, just to reach out, because we are here, we're in this together. And unfortunately, my personality, I guess, is one of the kind that I try to withdraw a lot. I do have my friends, you know, here in the United States as well, and, and all over the world, and my family the other side of the ocean. I always joke about it, the other side of the pond. But it's not easy, because in day-to-day life, you know, you have to get through. You have your work, you have your children, you come home and you do the same thing, and somewhere in there, you know, you lose yourself if you
Absolutely.
don't pay attention.
That's true. That's true. Wow. So you had not only the struggle of the cultural shock being from one country moving to another, and you're moving to the country as an adult, as a professional, for where you had to redo all of this. I mean, it's already hard doing your medical training at one point, but then moving and having to redo parts of the training, and then not having the support at home during that process. So you were able to overcome that. You learned a lot from it, and you have documented this in this book, The Warrior Woman Project, to let others know that even though I did it alone and I pulled away, I know that there are other ways to overcome. I still had the strength and the mental fortitude to do it. So I know that you can do it also. But here are some of the things that I learned. And here is how I want to help you so that you don't have to make the same mistakes.
Absolutely.
Wow, you are a warrior. Not
Thank you.
only are you helping those physically, but you're also helping it in your free time by putting out such a personal story out there for others to embrace and to also learn from. Doc. You are absolutely a doc who cares. I love it. I love it. I love it. So now that we have pulled that from you, I want you to tell us something fun that you like to do. What is the way that you like to relax?
Definitely with my family, getting out with the children and nature. That even I've learned throughout the years, because many times I would say, oh, let's just have a low-key weekend, let's just hang out around the house and not do much, or just the basics. But I've noticed that if we get out, and even if it's just for the day, just a short hike or going to the park or something, it honestly helps me to reset. And that's my to-go thing now. So if we can do it every weekend, but every so often, a couple of times of the month, we do get out. And then the other thing what I would like to do, I've noticed I draw energy and strength if I sit by myself, meditate. Many times, during the week it's kind of hard because we're on a schedule and this and that, but on the weekends I make sure that at least I set aside either 30 minutes or an hour to an hour for myself, where I can reflect and think, and that helps me tremendously to plan and to reevaluate everything. I'm just very thankful and grateful for everything in my life, and I just want to be a better human every single day.
Yes, pulling that strength from within and filling the cup so that you're able to help others. That's wonderful to be able to find the way that you can reflect, like self-reflection, gratitude. Wow. The process of being grateful and acknowledging it is so rewarding. So if you are out there and you have not started, or if you are thinking about starting a gratitude journal, or just saying out loud daily, like, hey, this today I am thankful for blank, it is just so amazing how it changes the trajectory of your day. Just waking up and just acknowledging what you're thankful for, and what you are grateful for, and really using it in first person. Not, oh, it is nice that. No, I am grateful for is really powerful, right? And you pull it
Absolutely.
out. So, Dr. Andrea Staneta, I thank you for spending this time with me and for informing all of our listeners about PM&R, or physiatry, not to be confused with psychiatry, and also letting us know about your Warrior Woman project, about the anthology that you and 14 other women through all over the world have poured your heart and soul into this book, that is published here during the time of the pandemic, to help others understand and to let them know what you've overcome, and to give them a source of hope, and to help them to be confident so that they can also overcome any trials and tribulation that they're going through at this time. Alrighty, guys. Well, I'm Dr. Tamar Beckford with Your Caring Docs. We thank you, Dr.
Thank
Stanata.
you. Thank you so much, Dr. Beckford. Thank you for
Pleasure.
everything you do. You are amazing. One day I'm gonna grow up. I'm gonna be like you.
Well, thank you. I want to be like you. You did it all. I'm Dr. Tamar Beckford with Your Caring Docs. Before we do leave, I do want Dr. Stanata to know. Let us know, where can we find you?
Yes. So on Facebook, it's Andrea Staneta. Instagram at Andrea Staneta, one word, and then on LinkedIn, Andrea Staneta MD. So I'm more than happy to connect. Message me in any way I can help. I'm here to help.
Wonderful, wonderful. Well, we're here at Your Caring Docs. That's URCARINGDOCS. You can find us on YouTube. You can find us on Instagram. You can find us on Facebook, Twitter. We're all over LinkedIn. And we're also going to be revamping the Your Caring Docs website, where we will be highlighting and featuring our Dr. Stanata, or Staneata. I've been screwing up her name this entire time, but she's so graceful that she just let me do it. Dr. Staneata, who is going to be one of our features on our Your Caring Doc website as one of our docs who cares. I'm Dr. Tamar Beckford, and we will see you next time.